Good morning, students. Yes, take your seats, all of you. Yes, very good morning. Now we'll start with the topic hypoxia, and at the end of the lecture, you will be able to define hypoxia. What is hypoxia? Then types of hypoxia. You will be able to classify the hypoxia at the end of the lecture. What is various types like anemic hypoxia, hypoxic hypoxia, stagnant hypoxia, and histotoxic hypoxia. Then, at the end of the lecture, you will be able to also define cyanosis, causes of cyanosis, and the treatment of cyanosis. Then, what are the signs, symptoms of hypoxia? Then, at the end of the lecture, you will also be able to know the treatment, how to treat the hypoxia. So at the end of the lecture, all these points you will be able to answer out. Whether these are the questions asked the university level or the assignment level or viva questions or any MCQ, you will be able to perform well. So what is hypoxia? Yes, it is the decreased availability of the oxygen at the tissue level. So this is very important, tissue level. You all forget to tell about, you say decrease oxygen. But important point is you have to also tell us or in the answer out that it is also decrease in the oxygen at the tissue level. So what is histotoxic hypoxia? As the name is suggesting, when tissue cannot utilize oxygen. When tissue cannot utilize oxygen in spite of normal oxygen supply. So oxygen supply is normal. Kindly note, normal oxygen supply is there, but tissue is not able to utilize the oxygen. This will result into the histotoxic hypoxia. So, what is histotoxic hypoxia? When tissues cannot utilize oxygen in spite of normal oxygen supply. In spite of normal oxygen supply, resulting hypoxia is known as the histotoxic hypoxia. As tissue is unable to utilize oxygen, so the venous tension of oxygen is high. So, venous tension of oxygen is high. And hypoxia usually occurs in tissue poisoning. It's not that usually occurs in the tissue poisoning. As produced by the cyanides or similar poisons So, whenever the tissue cannot utilize oxygen in spite of normal oxygen supply, this will lead to the histotoxic hypoxia. And important feature that venous tension of oxygen is high, commonly seen in tissue poisonings. tissue poisoning. Now, what is the mechanism? Mechanism of hypoxia will depend on the cause of the hypoxia. It will depend on the cause of hypoxia. For example, in cyanide poisoning, cyanide inhibits cytochrome oxidase. Therefore, the tissue oxidation is paralyzed. Therefore, the tissue oxidation is paralyzed. So, mechanism involves the cause. Why this hypoxia has occurred. For example, seen in the cyanide poisoning. Another is diphtheria. Diphtheria. In severe diphtheria toxin inhibits the synthesis of cytochromes and therefore prevent the oxygen utilization. It will prevent the oxygen. So, causes we have seen cyanide poisoning or in the severe diphtheric condition. In the severe diphtheric condition. What is the treatment? Yes. So, in the cyanide poisoning is treated by methylene blue or nitrites. Methylene blue or they form meth hemoglobin. क्या बनाते हैं? They form meth hemoglobin, which in turn will react to the cyanides to form cyan-meth hemoglobin. Cyan-meth hemoglobin, which is non-toxic compound. It is a non-toxic compound. So, what we do will do in the favor of the patient in the cases of cyanide poisoning, yes, will be treated with methylene blue or nitrites. Hence, this in turn will react with the cyanide to form cyan-meth hemoglobin, which is a non-toxic compound. Hyperbaric oxygen therapy is also useful in cyanide poisoning. So one is the treatment with the methylene blue and nitrates, and another is hyperbaric oxygen therapy. Hyperbaric oxygen therapy. Now, this table is very, very important, students, very, very important, as it is showing the comparison between the various types of hypoxia. Various types of hypoxia. So, very important, you learn it by heart. By this, you can perform many questions, theory questions, viva questions, MCQ questions, and plus you get the good concepts also. So, in the hypoxia, in the case of hypoxia, there is low arterial PO2. What it is? There is low arterial PO2 due to decreased oxygen in the environment. In the hypoxia, there is low arterial PO2 due to decreased oxygen in the environment, and when the oxygen carrying capacity of blood and rate of blood flow to the tissues are normal. So, what is the cause of hypoxic hypoxia. Or what is the definition of hypoxic hypoxia? Is low arterial PO2 due to the decreased oxygen in the environment itself. Environment itself में क्या है बेटा? Low arterial PO2. Now, what is anemic hypoxia? What is anemic hypoxia? Amount of hemoglobin is less available. Amount of hemoglobin is less available to carry oxygen. To carry oxygen. In spite of normal arterial PO2. So arterial PO2 is normal. Okay. Arterial PO2 is normal, but amount of hemoglobin is less available to carry the oxygen in spite of normal arterial and normal rate of blood flow to the. So, no, arterial PO2 भी normal है बेटा, and normal rate of blood flow to the tissues is also normal. Okay. Now, another definition, stagnant hypoxia. Stagnant hypoxia. What is stagnant hypoxia? As the name is telling, rate of blood flow to tissues is reduced. To the tissues is reduced. So that adequate oxygen is not delivered to them in spite of the normal arterial. So arterial PO2 is normal. Okay, arterial PO2 is normal and hemoglobin content is also normal. Hemoglobin content is also normal. Rate of blood flow to the tissue is reduced. And in histotoxic hypoxia, normal oxygen delivery to the tissues, normal oxygen delivery is there to the tissues, but tissue cannot make use of that oxygen supplied to them because of the action of the toxic agent. That is, a toxic agent is present. Hence, the oxygen is not able to be supplied. In spite of normal oxygen delivery to the tissues cannot make use of it because of the presence of the toxic agents. Now, what is the cause of hypoxic hypoxia? You must know, children. You must know the causes of the various type of hypoxia, which will be covering. Causes of hypoxic hypoxia? Yes. Decreased atmospheric PO2. Decreased atmospheric PO2. Less pulmonary ventilation. Less pulmonary ventilation. Defective BP ratio. Defective ventilation perfusion ratio. So all these causes will lead to hypoxia. Decreased atmospheric PO2, less pulmonary ventilation, and decreased BP ratio. Total hemoglobin content is less in the case of the anemic hypoxia. Anemic hypoxia. hypoxia, total hemoglobin content is less. As seen in anemia itself, any condition causing hemorrhage, any condition causing hemorrhage, presence of abnormal hemoglobin. Any condition in which there is presence of abnormal hemoglobin like COHB or meth hemoglobin or meth hemoglobin. All these conditions will cause anemic hypoxia. So in anemia or in hemorrhage or in presence of abnormal hemoglobin, this will cause the anemic hypoxia. Then stagnant hypoxia, what are the causes? Yes, very good. What are the causes? Circulatory failure. Yes, circulatory failure. Obstruction of blood flow. Yes. Heart failure. So these all will lead to the stagnant hypoxia. Stagnant hypoxia. Then another, cyanide poisoning. Cyanide poisoning will lead to the histotoxic type of hypoxia. Histotoxic type of hypoxia. Arterial PO2 in the case of the hypoxia is decreased. Whereas arterial PO2 in the anemic hypoxia is normal. In stagnant hypoxia, again normal. And histotoxic hypoxia, it is normal. It is normal. Arterial oxygen content. Arterial oxygen content decreased. Is decreased. Anemic hypoxia markedly reduced. In the stagnant hypoxia, it is normal. In histotoxic hypoxia, it is again normal. Arterial oxygen saturation of hemoglobin. Percentage of arterial oxygen saturation of hemoglobin is decreased. In anemic hypoxia, also it is decreased. In stagnant hypoxia, it is normal. It is normal. And in histotoxic hypoxia also, it is normal. It is normal. Arteriovenous PO2 difference. Arterial venous PO2 difference. Decreased hypoxic hypoxia. Anemic hypoxia, it is normal. Stagnant hypoxia, it is more than normal. And histotoxic hypoxia, it is again less than. It is again less than normal. Cyanosis. In hypoxic hypoxia, it is present. It is present. In anemic hypoxia, it is absent. It is absent. In stagnant hypoxia, it is again present. In histotoxic, it is absent. It is absent. As reduced hemoglobin is produced in small amounts. So, it is not possible in the case of the histotoxic hypoxia. So, to summarize this table is very important and it is a comparison between different types of hypoxia. So, you have to remember it. Hypoxia, there is low arterial PO2, causes decreased atmospheric PO2, less pulmonary ventilation, and defective VP ratio. Arterial PO2 is decreased, arterial oxygen content is also decreased, AVPO2 difference decreased, and cyanosis is present. In the case of anemic hypoxia, amount of hemoglobin is less available. Amount of hemoglobin is less available in spite of normal PO2. This you have to remember. Will be seen in anemia. We have already done anemia, hemorrhage, presence of any abnormal hemoglobin. Arterial PO2 will be normal. Arterial oxygen content will be markedly reduced. AVPO2 difference will be normal and cyanosis will be absent. In the stagnant hypoxia, rate of blood flow to the tissue is reduced. Rate of blood flow to the tissue gets reduced, so that adequate oxygen is not delivered in spite of normal. Then causes we have seen, we'll quickly revise: circulatory failure, obstruction to blood flow, and the heart failure. Arterial PO2 is normal, arterial oxygen content is normal, AVPO2 difference is more than normal, and cyanosis is present. Histotoxic, here the tissue cannot make use of the oxygen due to the action of the toxic agents like cyanide poisoning, and the arterial PO2 here is normal, oxygen content is normal, AVPO2 difference is less, and cyanosis is absent. Cause we have already seen, yes, as reduced hemoglobin is produced in small amount, so there will be no cyanosis seen. No. And further, stimulation of the peripheral chemoreceptors will be seen in the hypoxic type, absent in the anemic type, and stagnant present. And here also again histotoxic present. So these points all you have to remember, and you take an assignment and you make this table and will show me in the next class. Then what are the effects of hypoxia? You are being asked the question, what are the effects of hypoxia? We will study. It is mainly affecting central nervous system. Remember, it is mainly affecting CNS, central nervous system, especially the higher centers. Many centers depend upon the oxygen. So severity, duration, and type of hypoxia. So it will all depend upon the hypoxia. Now they can be classified as acute or subacute hypoxia. Acute or subacute hypoxia. In the case of acute hypoxia, resemble acute alcoholism. Alcoholism, that is impaired judgment and motor incoordination, and motor incoordination. These are the major manifestations of acute hypoxia. If it persists for longer, अगर बेटा hypoxia अगर ज़्यादा time तक persist करता है, the features are क्या क्या होते हैं? Fatigue, you will be seeing fatigue, drowsiness, nausea, headache, hyperventilation, and dyspnea. Apathy, inattentiveness, delayed reaction time, reduced work capacity, confusion, and disorientation. And additional to it, in the case of the severe hypoxia, hypertension occurs. Hypertension occurs. In severe and prolonged hypoxia, brainstem is depressed and death results from the respiratory failure. And what are the effects of hypoxia? Mainly affects the CNS, anaerobic glycolysis results in the formation of more and more lactic acid. More and more lactic acid is formed. That leads to metabolic acidosis. Metabolic acidosis. Stimulation of chemoreceptors occurs, producing hyperventilation. So additionally, हमें और क्या मिलेगा? Yes, students, we will be seeing hyperventilation and causes respiratory alkalosis. Will cause respiratory alkalosis. However, we combine with metabolic acidosis and serum bicarbonate level will decrease. Then at the cellular level, transcription factors known as the hypoxia inducible factor HIF are produced by hypoxia. They have alpha and beta subunits. Kindly note, alpha and beta subunits normally in presence of adequate oxygen in the tissues. Alpha subunits are rapidly removed from the cells. Alpha subunits are rapidly removed. In the hypoxic conditions, dimerization of alpha and beta subunit will occur. Dimerization of alpha and beta subunits occurs in the cells. The alpha and beta dimers cause induction of genes that produce erythropoietin and angiogenic factors. तो क्या क्या प्रोड्यूस होता है बेटा? Erythropoietin and angiogenic So कौन से दो फैक्टर्स भी प्रोड्यूस होते हैं इंड्यूस द जीन? Erythropoietin and angiogenic factors. What are the effects on brain? Effects on brain. Yes. Brain tissue is very sensitive to hypoxia. Very important point. Brain is very, very sensitive to hypoxia. And whenever there is sudden fall in the inspired PO2 to less than 20 millimeter mercury, it causes loss of consciousness. So we have to be very careful. If there is less fall, less than 20 millimeter mercury, there can lead to loss of consciousness within 15 seconds. Within 15 seconds. If hypoxia continues, death can also. So we have to quickly treat the hypoxia. Otherwise, the death can occur in 4 to 5 minutes. So less than 20 millimeter mercury. मार्क कर लीजिए PO2 लेस हो गया है as low as 20 millimeter mercury, and it may cause consciousness, and if prolonged, then death may also. This can typically occur in sudden drop in the cabin pressure in a plane flying above 16,000 meters. अगर suddenly pressure reduce होता है in the planes when it is flying high around 16,000 meters and above. However, hypoxia of lower intensities cause symptoms similar to that of the acute alcohol intoxication. Acute alcohol intoxication. Such as कौन-कौन से symptoms होंगे? Disorientation, impaired judgment, headache, drowsiness. Impaired judgment, headache, and also the drowsiness will be seen. The case of the chronic hypoxia, polycythemia occurs due to increased erythropoietin production and local hypoxic vasodilatation. Now, what is cyanosis? Yes, cyanosis is the bluish discoloration of skin, and mucous membrane in the body due to the presence of reduced hemoglobin. Very important. So bluish discoloration of the skin and the mucous membrane because of the presence of the reduced hemoglobin or deoxyhemoglobin more than 5 gram percent in the blood. कितना अपन को clinically कब मिलेगा? More than 5 gram percent in the blood. Cyanosis is normally detected when oxygen saturation is less than 85%. It is also seen in excess of abnormal hemoglobin derivatives such as methemoglobin or sulfohemoglobin. Now, what is the physiological basis? When the concentration of reduced hemoglobin is more than 5 gram, कितना? More than 5 gram percent, the capillary blood, the skin, and the mucous membrane become blue. Because of dark color of the reduced hemoglobin. तो हमें क्यों ब्लू दिखता है? Because of the dark color. Dark color किसका होता है बेटा? Dark color of the reduced hemoglobin. Hemoglobin in the arterial blood is 95% saturated with oxygen. In mixed venous blood, about 70% of the hemoglobin saturated with the oxygen. Hence, 10.5 gram or 15 gram percent hemoglobin in the venous blood hemoglobin and 4.5 gram is reduced hemoglobin. कितना होता है? 4.5 gram is reduced hemoglobin. Amount of reduced hemoglobin in capillary blood is assumed to be mean of arterial and venous content. Thus, a normal individual at rest, capillary blood कितना होता है? Contains 2.6 gram per 100 ml, 0.75 plus 4.5 by 2 of the reduced hemoglobin. Presence of excess of other hemoglobin complexes with the methemoglobin and sulfohemoglobin. Cyanosis will not be seen in the severe. Important point. Cyanosis नहीं मिलेगा बेटा है ना in the severe anemia and in the carbon monoxide poisoning. क्यों? Having severe anemia, the hemoglobin content is already less. And in cyanosis, as total hemoglobin is less, also cyanosis may not be seen in the carbon monoxide poisoning because carboxyhemoglobin prevents reduction of oxyhemoglobin and the color of the carboxyhemoglobin is cherry. We will not get the cyanosis. Now types, three types: peripheral, central, and mixed type. Peripheral, central, and mixed. In central cyanosis, inadequate oxygenation. Inadequate oxygenation. In peripheral, sluggish peripheral circulation. So in central, inadequate oxygenation of systemic arterial blood. Sides to look: tongue and oral mucosa, acral tip of the nose, earlobes, then outer aspects of the lip, fingertips, nail bed, and the extremity. Associated with central will be associated with clubbing and polycythemia. In the central, extremities will be warm, whereas in the peripheral, it will be cold. Warming extremities, no change. Cyanosis disappears in the cases of the peripheral. Oxygen's inhalation, central may slight improvement, peripheral may no change. ABGPaO2 low as much as 85%, but here it is normal. Pulse volume may be high in the central, but usually low in the peripheral. Peripheral cyanosis occurs due to the slowing of the flow of the causes decreased cardiac output, local vasoconstriction, venous obstruction, and increased viscosity of the blood. Central cyanosis, when reduced hemoglobin concentration is more than 5 grams per cent. Mind you, you have to note it. Due to the admixture of venous and the arterial blood, like right to left shunt, in which the venous blood bypasses the pulmonary circulation, like in the congenital heart disease, like Barrett's pathology, or pulmonary arteriovenous fistula, patent truncus arteriosus, and transportation of the great vessels. Due to adequate oxygenation of the arterial blood. Inadequate oxygenation कब होगा बेटा? Low arterial oxygen and high altitude. Inadequate ventilation of the example. Then in the mixed cyanosis, in this type of cyanosis, both central and peripheral mechanisms operate. Both central and peripheral mechanism will operate. The most common example is chronic cor pulmonale due to emphysema, seen in cardiogenic shock with pulmonary edema,